Welcome back. Recent studies show that more than half of our LGBTQIA plus young people are unable to get proper mental health care and support to ensure their overall wellness. Unfortunately, it is our LGBTQIA plus communities across the country that are facing a number of challenges, with stigma and discrimination being two of the main reasons why depression rates remain consistently high within this population. Here to tell us more about these mental health challenges and what's being done to help here in West Michigan, we've got Dr. Christopher Palazzo, a primary care physician in Grand Rapids, as well as Dr. Lisa Lowry. She's section chief of pediatrics and adolescent medicine, both with Corewell Health. Thank you both for being here with us today.
Thank you.
Thanks for having us.
And Dr. Palazzo, talk a little bit about why mental health is such an important part of our overall physical and individual wellness.
Yeah, so we know that physical and mental health are not separate, they're tied together. So it's not surprising that changes in our mental health can cause changes in our physical health. In fact, in a minority population like the LGBTQIA plus population, there's stigma, and chronic stigma over time leads to increased stress, which we know changes hormones in our body, things like cortisol levels, which have been found to have a profound effect on other physical symptoms, such as our gut health, can cause things like headaches, can cause things like insomnia, restlessness, body pain, things like that can definitely be experienced by those that have mental health.
Yeah, absolutely. Our mental and physical health tied so closely together. So, Dr. Lowry, what mental health challenges are you seeing specifically within this population?
Well, we see increased rates of anxiety, depression, increased thoughts of suicidality. There's also increased risk of stigma and fear. It's just the fear of, can I go to the provider? Can I find a mental health provider or provider that is gender affirming? And then there's this fear of, or will I be victimized again? And so all those things that you mentioned and Dr. Palazzo mentioned leads to the fact that a lot of people in our LGBTQIA plus community decide, I don't want to seek healthcare. I'm not going to seek healthcare. And then that leads to more health disparities.
Absolutely. Absolutely. So nice to hear that Corewell is inclusive of all people. Tell us about what you're doing to improve access and then provide that mental health support to this community.
Yeah, so at Corewell, we've developed specific criteria, specific training for providers to be designated as LGBTQIA safe providers. We've made it easy and accessible on our website to find those folks that provide this care and offer this care. We've also implemented LGBTQIA plus patient Navigator, who you can call, find the services that you need. And our providers are always doing special training, continuing medical education to stay on the cutting edge of how we keep ourselves safe and affirming here at Corewell.
Wonderful. Dr. Lowry, what can someone expect when they're coming to your office seeking care?
Well, we're hoping to provide a warm, welcome, and affirming environment. And that is my call to action to all providers, whether you're at Corewell or one of, excuse me, across our community, is that you and your staff can do things. There's a lot of websites out there like the Fenway Project, Trevor Project, where you can actually access these free trainings. But we want to make sure we have a warm, welcoming environment and safe. And that our providers are knowledgeable. One of the things we hear from our community is that, well, I don't want to have to come and explain myself to my provider. So my call to action is to please do a little education, become aware of the health challenges, and not to expect that our patients need to explain all their concerns to them. So that's what we aim to with some of the trainings that Dr. Palazzo mentioned. That's some of the things that we are doing and implementing at Corewell Health.
Wonderful. And, obviously you guys are providing compassionate care to anyone. If someone is out there watching, listening right now, hasn't sought health care for whatever reason, how can someone get more information or maybe connect with one of those navigators that can help them with this journey?
Yeah, so we have a fantastic website, www.spectrumhealth.org/LGBTQIA, which has a huge breadth of information and resources in order to get connected with our Navigator or just learn more about what services we provide.
Wonderful. Dr. Laurie, Dr. Palazzo, thank you so much for being with us and for sharing this important message today. We really appreciate it.
Thank
Thank you
you.
for having us.
All right. Once again, there is the website if you want some more information, spectrumhealth.org/LGBTQIA. We'll be right back.